Hi, I'm Vince Hartman, co-founder and CEO of Abstractive Health. I've been in healthcare 10 years as a PM at Epic, Robin, CityBlock, and I became really good at electronic health record or EHR integrations. During that time, I saw doctors struggle with burnout in the EHR. Burnout is a huge problem. 60% of doctors struggle from it. And the primary cause is the EHR. 49% of their time is spent documenting in the EHR, and yet they're missing out on $125 billion in potential revenue each year. Essentially, it's because they only have 3 minutes to review your chart before a visit. And in that time, they will miss critical information and follow-ups that will lead to poor health outcomes for you. Let me walk through the workflow. So first, the physician has to review your medical chart before a visit. Next, the physician has to take notes or hire a medical scribe to do so at the visit. And last, the physician has to summarize your care, do medical coding, and then transition your care. Previous NLP companies have focused on automating the scribing portion, but this is only one component of the overall workflow. It's a small problem. It's only that one component. Abstractive Health is focused on the white space opportunities with full automation. We are the only company operating in this space. Our solution is we condense the hundreds of pages of medical notes into a few key sentences using generative AI. This is very hard to do. We are the only company that can automatically summarize the entire medical chart at a physician quality level. Let me tell you why this is hard. First, LLMs have word limits. The word limit represents how many words you can feed into the LLM before it cannot process anymore. So with an open source LLM, you could do one clinical note or a doctor-patient conversation, but you can't do the entire medical chart. It has too many words. You need proprietary technology. Next, LLMs are not clinically factual. They're known to hallucinate medical data. And last, LLMs are not built for privacy and safety first. In November 2020, my co-founders and we formed a partnership with Weill Cornell Medicine to solve these problems. Over 3 years, we overcame these problems and more to get to our current product. Let me dive into a few of those for you. First, we developed an NLP method that can summarize the entire chart, 300,000 or more words, and it's highly accurate. We published that research and we have a patent filed for our method. Next, our approach, it is clinically factual. We pre-trained our LLM on 100,000 charts through a partnership with Weill Cornell Medicine. We then took 10,000 of those charts, had them further annotated by physicians, and then we developed a method that constrains hallucination of medical words. Our method is also HIPAA, SOC 2 compliant, and we can deploy it on-prem for any customer. But most importantly, it works. Our AI summaries have crossed that gold standard threshold of equivalent physician written summaries. AI has been attempting to cross this threshold for years, and we have done so. The product integrates directly into the EHR system. We identify the most salient notes and then comprehensively create a summary in less than 15 seconds. We cite every sentence in our summary back to the original source notes. And remember that $125 billion that's lost each year in potential revenue? Well, we optimize the physician's notes to increase their billing downstream. We've brought together a best-in-class team of NLP experts, healthcare experts, and Ritika Podar, our CTO, she's been doing this research with me for the past 3 years. And Xinwen Zhang comes from a PhD from Duke and NLP, and then 3 years at ASAP, a top NLP company. We currently have paid pilots at New York Presbyterian, the Cleveland Clinic, and a grant with the National Science Foundation. The physicians in the emergency department with our pilot have been so impressed that we have increased our applications in scope. These 3 contracts represent an opportunity of 1.2 million in ARR. We are on track to close 7 more contracts in the next 12 months, which represents a 2.8 million ARR opportunity. So we've been focusing on academic medical centers. We've built out a data pipeline, and we're demonstrating credibility in healthcare. This market is huge in academic medical centers. And then additionally, in the next 6 months, we're going to expand to private physician practices. We charge $400,000 per year per academic medical center and $5,000 per year per independent physician practice per physician. This is a market size of 4.9 billion. Now, our wedge market is summarization and coding, but our vision is we are building an AI clinical assistant that streamlines all patient data. We're revolutionizing healthcare and reducing burnout. Thank you so much.